Robotic surgery and its role in mesothelioma patients needs to be clarified, and we can talk about the pros and the cons. Robotics really is part of a large operation. So really it should not be seen that you're doing this big surgery with a robot. That is not at all the case. A mesothelioma operation, at least at our institution, is a radical pleuropneumonectomy. In that operation, you're taking out all the pleura, you're taking out the lung, the entire lung, you're taking out the pericardium, you're taking out the diaphragm, and you're reconstructing the pericardium and the diaphragm. The place that the robot comes in is in the beginning of the operation, where the robot allows us to know, should we proceed with the surgery in this patient? Because again, we have not made an incision. We're just looking underneath the pleura and doing the pleurectomy portion, the removal of the pleura with the robot. Once we know that we should proceed, there's no disease going across, we continue on with the robot, take out the pleura. And the robot, in our experience, plays wonders in those crevices where your hand is blindly working if you're doing conventional work, but with a robot, you're actually getting into those spaces and taking out all the disease. That's the extent of the use of the robot. So it is for the pleural resection. Now, there's another important point about the pleural resection. One of the large problems and which causes morbidity in patients who have this surgery is blood loss during surgery. And the blood loss comes when you are peeling the pleura from the chest wall. There are blood vessels penetrating the pleura all over the place. So when you're peeling this pleura, bluntly, you basically cut the blood vessels. And they're going to bleed until you either coagulate them or they stop on their own. That's a lot. And the average blood loss in a patient who gets this operation is about 2.5 liters. 2.5 quarts of blood loss. That's half the blood volume. And of course, you give the blood back and there are many complications related to that. With the robot, you coagulate the vessels before they start bleeding. So the average blood loss with a robotic assisted operation is only 200 cc's, 1/10 the blood loss. So that's the other big advantage of robotics. In terms of what is bad about robotics, frankly, very little in this situation. So the only issue with robotics in terms of its use in mesothelioma patients or any patient is the experience of the surgeon. Robotics really is complex technology. You have to know how to use it. And then when you have the experience, you can apply it to a patient who has mesothelioma very easily. So there are very few downsides to the use of the robot and certainly a number of very important advantages.